Knock, knock, knock. I'm gonna pull the curtain to provide for privacy. I'm gonna perform hand hygiene. And I will be wearing gloves as appropriate. Hi, my name is Tiana. I'm gonna be your nursing student today. Can you verify your name and date of birth, please?
Joseph Smith in 1953.
That's covered. I'm looking at your wristband to ensure 2 patient identifiers. Do you have any allergies that you're aware of?
Nope.
Looking at your wristband, showing no allergy band. I'm looking at your provider's orders here, and it looks like I have to draw some blood off your central line, and then it's time to change your dressing. Do you have any questions?
Nope.
Okay. Ensure you're in a comfortable position. Are you comfortable?
Yep.
Okay, I'm gonna raise the bed up to working height, and I'm going to expose this area I'm going to pause the fluids, clamp this line, as well as clamp the central line here. And then I'm gonna open my cap the wrong way. Attach it. And then I'll throw the end of this over the iPad. Just out of the way from here. Okay, awesome. So now that I have this, I have all my supplies here, and I'm gonna ensure that they're all not tampered with and not expired. I am putting on gloves. I gelled my hands. I'm gonna open my syringe, keeping it in the boat. Okay. I'm gonna open my connector, 2-inch to prime it. I'm gonna get rid of my air bubble, and without breaking sterility of the tip of that, I'm gonna flush and prime it so that it's ready to go on my patient. I am going to ensure that this is clamped and take a alcohol prep pad and scrub for 30 seconds and allow it to dry. I'm gonna open my syringe, get the air out so I'm not putting that directly in their heart, attaching thumb to thumb, and opening my clamp. I'm immediately gonna pull back for blood, because it should always have blood return, and then using the push pause method, I'm gonna flush ordered amount. And then before I remove this, I'm going to pull back for my waste blood. So I'm gonna pull back and get some blood. I'm going to clamp it to ensure no backflow or fluid. Okay, lab, how much blood do I need?
8 milliliters.
8 milliliters, so I'm going to attach my sterile syringe, thumb to thumb. Unclamp my line. Perfect. Thank you. I promise. I'm gonna unclamp it. I'm gonna pull back 8 milliliters of blood. Unclamp. Pull back my 8 milliliters. I'm going to clamp it back. Clamp my line. And then hand this to lab to take. I'm going to dispose of my other bloody item appropriately. I'm going to, now that this is still clean, I'm going to attach my new, remove the old autoclave and attach my new one sterilely, and then flush a little bit. Unclamp again, and flush a little bit to ensure, and then I'm gonna keep that on there, clamp, and then remove. So that's my first step. I'm gonna clean up my supplies and ensure that my patient doesn't need anything. I'm gonna change my gloves, so I'm gonna throw these away. I'm gonna gel. At this time, I'm gonna put on clean gloves. I'm gonna put a mask on myself. exposing the area. And I'm going to be putting a mask on my patient as well as covering this trach because that can emit germs. I'm putting on my clean gloves. Sorry. Putting on clean gloves. Pulling this closer. At this time, I'm going to, without touching the insertion site, remove this dressing. I can't do it fully, otherwise the patient's skin will actually fall off. So I'm just gonna verbalize that I removed this, have it in my hand. I'm gonna go like this, keep it in here, and then throw it away. Now that's exposed, I'm gonna jump. And now I'm gonna open my central line kit, dressing tray. So, in my sterile location. Opening, removing this.
Okay. Some of them are blue, some of them are. And we'll have an empty one.
Keeping my 1-inch border. My patient and I already have masks on.
I'm stopping the flow of fluid.
Sorry. I have my sterile gloves. Touching my 1-inch border. Opening this fully. Oh, sorry. I'm gonna step over here so I can have a clear thing. My hands are clean. I'm going to sterilely put on said gloves. Sterile fairing. I would touch the inside. Sorry, team.
30 seconds.
Kimmy, that's you in the background. I'm going, now that I'm sterile, I can stay here. I am going to remove this. Open this sterilely and hand it to my helper and videographer. I'm going to sacrifice said hand to hold the central line. Now that this is not sterile, I'm going to also hold this back with this. I'm going to take my first alcohol swab, start at the insertion point, and clean vigorously without crossing over an area I already touched. I'm going to dispose of this. I'm going to take my second one, broaden my strip, clean vigorously, disposing of it. While I'm doing this for a minute, and while I'm doing this, I'm checking for any complications near the site, redness, drainage, a red streak, swelling, heating, or coolness. Just ensuring that it's good, and this is something I will document. I'm taking my third one, and I will be holding this up, and I'm gonna go back and forth vigorously to ensure that my line is clean. Okay, disposing of that, without going over my line. I'm coming back with my clean hand to start to peel this off. And I can use this part and pull. I would take the backing off of this. I am placing it so my insertion site, after it's covered and set, I can use both hands. I'm placing it so my insertion site is in this clear window and that it's intact and against my patient's skin fully. I am going to label this with my initials, time and date, and then I'm going to clean up my supplies. I can take my mask off me and my patient. I would wipe this, clean this, attach, using alcohol swab, clean the autoclave, attach my fluids back, unclamp, and restart my fluids. Are you in a comfortable position? Is there anything else I can do for you?
Nope, I'm good.
Awesome. Thank you.